you don't always get a happy ending.
On a late night shift in a hospital, a lady was brought as an emergency case. The patient was a 25-year-old woman who was 38 weeks pregnant. She was brought in by her husband, who said that she was experiencing repeated sudden convulsions since 2 days. Her blood pressure was through the roof. The JRs, that is junior residents, immediately suspected eclampsia and started her on Pristard regimen. Basically, a lot of injections of magnesium sulfate. Along with it, a lot of samples were taken and they were run for CBC, LFT, KFT, SC, PTNR, etc. etc. I was the one to take all these samples and run to the lab and get the results. After the initial treatment, the patient's condition improved, or so I want to say. But this is not a fairy tale. By the time I was back, the patient turned very bad. She was shifted to the ICU, which is so called the recovery ward. Irony is, she never recovered. This is the reality that I could never learn in medical school. 4.5 years of education gave me all the knowledge about her disease, the pathology, and her treatment. Yet all of it was useless in the end. The doctors did everything right, yet she could not be saved. And without a moment to recollect my thoughts, I had to go and run to help in another emergency. That is the life of a doctor. The dark side of medical education. Don't get me wrong here. I was prepared to do it all since the moment that I joined MBBS. I knew this was waiting for me, but I guess I could never prepare myself well enough. To be honest, no one can. It is the human life, the families that they leave behind, all depending on your decision. And sometimes, even if you take the right decision, the end is not a good one. We don't become doctors just by reading books. The clinical situations, facing this reality, that's what forges us into real doctors. Number 2, you go to the very limit of human body. I am growing up into the doctor that I always wanted to be. And over the course of these years, I have talked to many specialists working their respective fields. Some of the specialties are really easygoing, that is skin, radiology, but others really test your limit. Kids, if you think that 9 to 5 school is stressful, just wait till you step into MBBS. Here in OBGY department, the JRs have to work tirelessly for 36 hours or more on the admission day. No sleep, no time to rest in a place where everything can go wrong. What is proper dinner time? You get to eat when there are no emergencies waiting for you. Holiday? Have you seen a hospital closed on a holiday? Family time. You can sometimes call them on phone, but that's all. And if you get sick, just take some medicines and get back to work. Treat the patients beyond the limit of your own human body. Number 3, you need to be strong. In the COVID pandemic, since March 2020, on an average 3 doctors have died in the country every day. But it's just numbers. याद रख के भी क्या करे? These are just the people who were treating the patients when you and me were sitting at the comfort of our homes. These are the people who used to work tirelessly for more than 14 hours a day for weeks. These are the people who had to work every day and deal with multiple deaths while keeping a happy face. These are the people who messed up their health and gave up on their safety to treat mere strangers. It is nothing special, yaar. It is just their job. And if another wave of COVID hits, it will be my job too. So, I need to be strong. Number 4, you are not emotionless. In the first year of medical college, they teach you to dissect human bodies. Every year, when the first year students are taken to the dissection hall and shown how to dissect these bodies, at least 3 of the students in the room definitely faint. Over the course of the years, doctors really get used to death. It does affect us a lot. But we cannot show it. Imagine seeing a doctor cry while he's treating you. Will you feel safe? Will you really trust him or his treatment? That's why no matter what, we try to keep a confident face and a smile on it. We do have the burden of emotions, but we are just a little bit better to handle all of them. So next time you see a doctor, remember that we are not emotionless. We do feel your pain, but we have to be brave for you to believe in us. Number 5, you may get assaulted. Medical field is a highly respected field. You get a lot of blessings from patients and their families. Well, that blessing and respect part, scratch that, because sometimes you can literally get assaulted by the patients or their relatives. I am not even talking about verbal abuse here because it is so common that every doctor has to face it on regular basis every day. Even I have faced verbal abuse during my internship for those patients who were not even serious in the first place. Yes, I am so sorry for them, but that is just plain disrespectful. Unfortunately, we cannot reply back to any of them, firstly because we care for the patients, and secondly because any kind of verbal abuse can turn quickly into physical assault, and that assault can ruin our career and our very life. Imagine you want to become a surgeon and boom, someone gives you a blow on your eyes and you go blind. There goes your career. You get a hard blow on your head and spend months in the ICU. There goes your life. These are all real possibilities. The risk of physical violence against doctors can never be ruled out. So, even with all these, why do you want to become a doctor? Why do I want to become a doctor? Life is hard right now, and a million and one questions swarm through my head. I am trying to surrender to the unknown and the hardships that I am facing. Medicine isn't a career that will make you feel sure. It is going to give you doubts. It will make you question. Can I do this? Can I handle this? How will I survive all that? Will I even survive? But the minute you enter the hospital, see a patient, revive someone, that's when you feel it. Feel the security that this is what you want to do for the rest of your life. That is when you feel that this is your passion. Don't let these doubts get the best of you. Always have that moment in the day where you sit down and remember why. Why you started it all. Why you love this career. Why do you want to complete your dream? It is always a beautiful day to save lives. This is Dr. Abhijit signing out. See you next time.